You may have clients who've said, I have a hard time swallowing pills, or my mouth is so dry. One of the reasons is that besides getting older, that tends to happen, is because medications can give us a dry mouth. And the implication of that is when you have a dry mouth, you can get a lot of cavities. So this is somebody who had a dry mouth, and if you see, the cavities are all kind of by the gum line. So I'm showing you this because, if you're looking at someone's mouth and you see something like this going on, you need to tell their children, you need to tell their nurse that, did you know that Mrs. Jones has this going on? I saw this, I went to a lecture, and now I kind of know what's going on. So what's happening here is that because the mouth is dry, the food isn't going off the teeth as it normally would with saliva, and it tends to collect by the gum line. And that's when food is not taken off the teeth, it tends to cause cavities. And also your saliva is very important because your saliva keeps your teeth kind of slippery, and also it has antibodies in it and things that neutralize acids. So a dry mouth is a real problem. Also, it's a contributing factor towards aspiration pneumonia because they have a hard time swallowing. So this is a healthy mouth here. You can see the teeth look nice, cavities on them. The gums look kind of pink. Remember, I showed you those pictures before, all the food on the teeth and the swollen gums. So you don't see that here. And you may have clients who have, do you have clients who have dentures, some of them? Okay, and I'll show you about denture care. But yeah, so this is an upper arch, it's healthy, it's pink, there's nothing, don't look irritation. The lower arch is a lot, this is the ridge here, the person's tongue is up here. By the way, lower dentures have a harder time staying in than upper dentures, and you may have clients who don't wear their dentures at all because they have a hard time. I'll talk about that a little bit. But one of the reasons on the lower is because the ridge is so skinny, it's hard for the denture to have a good grasp on there. So something that happens as we get older is we do get some bone loss. So you might see in your client's mouth that the gums, receding gums, okay? So that's, if you have an infected mouth, that happens more quickly, but it is kind of the normal process to get some receding gums. In this case, what you're looking at here, these are the teeth. Those aren't cavities, but the roots of the teeth are kind of darker colored than the top part that has the enamel on it. So if you look in someone's mouth, you see that it could be just the root showing. Okay, so here's something that I think now you can say this is not, a healthy situation. So what's going on here? First of all, there's plaque and food on the teeth. Okay, the gums are swollen and red. So I'm going to tell you that when this person brushes their teeth, or when you brush their teeth, it's going to bleed. Okay, so let me take a step back and tell you, for you, if you're seeing any gum bleeding when you brush your teeth, that's a sign you have a problem. And you should not be seeing any kind of gum bleeding when you brush your teeth. For your clients, when they brush their teeth, there's going to be blood there. So if you see that when they're brushing their teeth, they have a problem. So what do you think this is over here? Very good, plaque or tartar, right? Yeah. So what happens, one of the reasons that we all need to go to the dental office and have our teeth cleaned professionally is that this is tartar or calculus, and it's hardened plaque. And when that gets on your teeth, you could brush from now till doomsday. It's not gonna, you have to have, usually a hygienist will do this, will clean it off. So one of the reasons you and your clients and your family members need to go to the dentist is because this stuff gets on your teeth and has to be taken off. And if you were to take this off, underneath there's going to be bleeding and it's going to be red. So this is an unhealthy situation. What do you see? What do you see here? It's kind of swollen, right? Bleeding, right? What's going to happen when they brush your teeth? It's going to bleed, right? Yeah. And again, I'm showing you this just to let you know this is something you should be, you're the eyes to be looking out for. How about, what do you see here? Cavities. Right, cavities, right. So on the healthy slide, you saw the teeth look nice. So over here, you see these dark spots, these cavities. So if you see this, their children, your client's children may not be looking in their mouths, but if you see this, like when you're helping them eat or something, you need to bring this to the attention because this person needs to see a dentist, because cavities don't go away by themselves. They just get deeper, and then you know what happens, it gets into the nerve, you have a problem. So if treated early, it's much better. So this is a fungal infection. So this is what happens is that sometimes in older people, their immune system is not as good, and a fungus is something that can grow because their bacteria get off kilter. Or let's say someone takes antibiotics because they have an infection, and maybe you ladies might know about this. If you get antibiotics, you get a yeast infection, right? So fungus, yeast, the same thing. So again, I'm not showing you this because you're not dentists to be able to diagnose everything. But if your client is not eating because they say, you know, my mouth is burning me, it's sore, you know, well, you should ask them some questions, or why, or maybe even take a look, or certainly alert again their children or their other caretakers that there's a problem there. By the way, this is very treatable. Some antifungal medicines will clear that up. But if you notice your client not eating or complaining of a burning mouth, that could be it. So what do you see here? Plaque. What about this tooth? What do you notice here?
Shift.
Right. Okay. So you look in your client's mouth, and all of a sudden on Mrs. McGillicuddy, you see there's a tooth that's down that wasn't down. So maybe she fell down and hit her face, and now this tooth is broken up in the root, and it's kind of loose. Okay. So what can happen from that is this is an X-ray of someone. This happens to have a crown on it, but someone who inhaled their tooth. So it's not in their stomach, it's in their lung, and that might need a lung operation. The reason I'm showing you this is that if you see something out of the ordinary that wasn't there before, you know, instead of just thinking that, well, they're old and their tooth is shifting, it could be because the tooth is broken, and this is something that needs attention. Again, you're being the eyes for others. What do you see here?
What is that?
Swollen.
Yeah, it's a gum boil, right? Yeah. So again, if they're complaining, if it's swollen or in your mouth, if you get a swollen gum boil, what that usually means is that the tooth has died and it's causing an infection up there. And besides just being a local infection above the root, it can go into their bloodstream and cause problems. So again, I just wanted to get a little used to seeing things. So this is something on the lip. So I don't know what this is. Probably, maybe this person bit their lip, okay? And you may have heard of canker sores. You can get those on your lip. Some people just are really prone to getting canker sores, and they're kind of painful. They last maybe 10 days. They may have burned their lip. You know, this is a little different from herpes, but also herpes can occur on the lip. By the way, you should always be wearing gloves if you're touching someone's mouth, because particularly something like herpes, you know, you can get infected, and that can really be a problem. But I don't know what that is. It could be lip cancer, you know. So, and you don't know what that is either. And if someone came into my office with this, I'd say, well, I think it's a canker sore, but try doing this to it. But if it's not gone in 2 weeks, you know, please let me know, or please come back in 2 weeks. I want to see. So generally, if you see something that isn't going away in a couple of weeks, you know, then you should let somebody know about that, because that means that there's a situation. So generally the mouth will heal up from a bite or something like that. The other thing you should know is that if your client goes to the dentist and has some dental work done, you know, and they get numb, you know what happens? Your lip gets numb, you can't tell what it is. And if they eat, they could chew their lip. And I've had that happen with patients, unfortunately. So if your client comes back from the dental visit and their mouth is numb, just be careful what they're eating, eat some soft things, and ask them if their lip is still numb, because they could easily chew their lip, right? Yeah.